Well, Steve, here we are.
Here we are.
We appreciate you taking the time to lead the rounds discussion today. We talked about patient connection, and really intriguing topic. And I think for over the last couple of weeks, we've talked about this kind of provider focused. How do we interact with our patients? How do we make those interactions more meaningful? And you kind of really focused on this idea of patient connection. So I want you to maybe take over for a minute. Just tell us kind of why did you choose that topic?
Yeah, I think it's something that I have been focusing on for a while. Like, how can I better connect with my patients? How can I make them feel seen, right? You know, I shared that quote from Brené Brown that was, patients want to be seen, heard, and valued. And as I was thinking about that, I was also thinking, that's what I want as well. Like, as a person, not just as a provider patient, but how can we maybe break that barrier down of provider patient and be just people conversing, and us going to a little bit deeper level togetherness of trying to figure out how we can solve problems together, create goals. And so that's, you know, as a provider, as a nurse, I think that's all about it as people, right? That's why we're in this.
And I love that quote that you had mentioned about, you know, the coach looking for the person first and the athlete second.
Right.
And I think that so much applies to our interactions with patients in that same line of thinking. It's like they're a person first, they're a patient second, right? And we need to find ways to connect with them on other levels so that we can have a more meaningful interaction. And I think that starts with being a little bit vulnerable. And we talked about vulnerability, right? So tell us kind of what that means to you.
You know, I think that if patients understand that we are people too, that we have things that we have to work on, that we can be a little bit vulnerable, you know, I think it helps them also open up, knowing that it's a person-person communication. I think sometimes there's just that. There's a known barrier. You walk into a clinic or you go to see a provider, and there's already a perceived barrier there. You know, whether they hold us in higher esteem or in lower esteem, whether they feel like we're actually going to listen to them or not listen to them, you know, and I think it's of the utmost importance that we try to level the playing field. We try to come in on the same level as them so that they understand we do care. We care about them and what they need. 'Cause again, what if I was in their shoes? What would I want? You know, and how can we do that as in that relationship of breaking down that barrier?
And one of the things that came to my mind as you were leading this discussion was the barriers that we face as providers. And I think one of the biggest barriers that came to my mind was the time constraints. How do we create an environment where a patient does feel heard, seen, and valued, understanding the demand that is sometimes placed in practices? And, you know, you kind of had a good answer to that, and just in the sense of how we interact. It's not so much the time, it's the energy. It's, you know, maybe you could talk a little bit more about that.
Yeah, I think that's something that patients don't understand in the moment. You know, as you become a patient, you lose a little bit of independence. You know, when you get into a hospital, a lot of independence is lost. When you're hurting, you lose independence. And it can be a little bit of a selfish reason of why that patient is there, and that's fine. But I think it's important for patients to understand our constraints. You know, we are seeing sometimes 40 patients in a clinic a day, and that puts a lot of energy, takes a lot of energy out of us as providers to make sure that that patient feels valued, right? I think that having a good attitude as a provider, walking into the room knowing why that patient is there, knowing their name. Like I'm really big on names, and I think that instantly shows them that you do care. It's not just like, okay, you're here for this, 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 and this. You know, if you walk in and you call them by name and you say, I've heard you've been having some struggles. Let's talk about that. Instantly, I think that person feels grateful that they came to see you today because they know that they're going to get listened to.
Yeah.
And I think that's super important. We want to make sure that our patients feel like almost that we're family, that we care enough. So that's what we'd want for our family too and ourselves, right?
Yeah, I love that. And I think that we as providers are striving for that. I witnessed it in the discussions today. I think it's a buy-in thing, and we've seen the community collectively come together, and we're striving to be better each and every single day. And I think continuing to have these conversations is what's going to foster that or reiterate the importance of it. And I think you've really opened our eyes today. We really appreciate the time you spent preparing this, and I think we all walked away hopefully better providers because of it, and willing to make those necessary changes in our practices. So we appreciate it.
Yeah, no problem.
All right.
Appreciate being here.
Thanks, Steve.
Thanks.